Welcome back. This Mental Health Awareness Month, our sponsors at Brylin Hospital are dedicated to normalizing the conversation around mental illness. Joining me now is Dr. Wendy, Unit Chief of Psychiatry at Brylin. Hi, Doctor. Thanks for coming in.
Oh, my pleasure.
I would like you to start off by talking about why mental health is so important.
Well, mental health is so important because the brain, like any other organ in the body, is an organ that's connected to the body. So mental health is so important because it really drives so many of our other physical issues. And without a good mental health, people can get depressed, anxious, overwhelmed, and then their physical health can fall apart basically as a result. We don't want that to happen.
That's right. So do you want to explain, and you kind of just touched on it, why mental health should be just as highly considered to work on as physical health?
I kind of don't separate so much mental health from physical health anymore, but I kind of combine the two together.
Okay.
Because, like I said, the brain's an organ, the kidney's an organ, the heart's an organ, so there shouldn't be that separation. When there's that separation, I think it adds to the stigma and makes it separate. But if we look at it as all one piece, then we can look at our overall full physical health.
Mm-hmm. What are some common misconceptions about mental health that contribute to that stigma?
This shame. Shame is huge. People who are suffering from mental health issues carry a lot of shame. They think they need to be strong. They think they're weak. They need to tough it up. Sometimes people think it needs to get to a crisis before they ask for help. And they don't realize that there can be subtle symptoms that occur where the person isn't functioning like they used to that gets in the way. And they think that they should just tough it up, so to speak.
And what are some of those symptoms that you yourself can look and internalize and think, I need help, or even a loved one that might pick up on what are these patterns that I'm seeing that makes me think something's off and maybe you do need help?
Yeah, so for example, someone that's normally very calm and easygoing suddenly becomes irritable or becomes agitated. Family notices a difference. Maybe they're like to go out to eat dinner or go to parties, and now they're suddenly saying, I don't want to go out anymore. I don't want to socialize. I want to stay home. Maybe if they're in school age, their grades are starting to suffer. Maybe they're calling in sick to work. So there's many things that can contribute.
And what resources are available for those dealing with mental health issues, and when is Brylin the right option for them?
So there's many things that people can do. They can talk to a friend. If they're in school, they can talk to their guidance counselor. There's therapists available. There's groups available. We want to promote, especially in this month, openness about talking about these issues. Brylin is when there's a crisis, and I always say it's better to be safe than sorry. So if you're really concerned about your mental health and you feel like maybe you don't feel safe or you feel like a loved one isn't safe, you can pick up the phone and talk to someone at Brylin Hospital, and we can help you.
How important is self-care for mental health, and what are some self-care tips that you might have for our viewers?
So I always look at it as like someone who has diabetes. You don't just take medication and be on your way. You have to exercise. You have to watch what you eat. And the same goes for mental health. Maybe you need medicine to help with your depression and your anxiety. But also, you want to create good boundaries. You want to have good friends. You want to have a good balance in your life. All the things I try to do.
Right? Or even just being more intentional. We talk about mindfulness.
Mindfulness. And maybe you need to, on top of, maybe if you need medicine, you need to see a therapist where you can talk about issues in a non-biased way.
Well, how do you think people, especially our viewers, can work to reduce the stigma around mental health?
We have to get out of our heads, and we have to say, this is a real illness. Mm-hmm. When people say to me, you know what, everyone's telling me this is in my head, I'm like, it is. The brain's an organ. Mm-hmm. It is in your head. And we have to get out of that blame and that shame. And we have to have good conversations and talk and be open about things that drive our mental health, just like our other issues in life.
Mm-hmm. And especially with families, you have to sometimes remove yourself of how you operate and think about what's best for that person, right?
Absolutely.
That loved one, and see, maybe this is not like them and I don't understand it, but maybe that's why they need help.
And also sometimes people say, you know, I see that in my loved one and then I see it in me. Mm-hmm. And let's get help together.
Yeah. Beautiful.
know.
Dr. Wendy, thank you so much for coming in. Always a pleasure talking
Thank
to you.
My pleasure.
Well, viewers, if you or a loved one are struggling with mental health, you don't have to go through it alone. Contact our sponsors at Brylin Hospital by visiting their website or calling the number right there on your screen. Thanks again, Dr. Wendy.
Thank you.